Hello, good evening once again. This is Dr. J at Ask the Gynecologist, and we are here live simultaneously on Instagram and on Facebook. And tonight I'll be talking about the things you should know about cervical smear. About cervical smear. If you've watched and you've gone through our post on Facebook over the last 48 hours, you will have seen a particular post I put out there about cervical smear. And many people are asking questions about this. And tonight I want to dissect this topic and ensure that people understand what cervical smear is all about, why it is done, and what should be the things you should look out for while you go for your cervical smear test. Okay, so if you're free tonight, join me and let's have a quick discussion together. And I'm hoping my audio is good. So I'm quickly doing a quick audio check. If my audio is good, let me know. And if I need to make any adjustments, let me know as well so that we can all be on the same page. Once again, first of all, I want to say good evening to you. And I'm Dr. Babajide Alalade, Dr. J, at Ask the Gynecologist. I'm one of your moderators here, and I'm happy to host you tonight. And tonight is all about cervical smear test. And if you're a lady, you are on social media, there's no other group that you're supposed to be apart from this one. This is the first group you're supposed to be, and it's going to be a disservice if you don't invite your friends to be part of this group. So if you have any friend that is between the age 18 to 64, let them know that there's a Facebook group here that we discuss maternal health concerns, and it's on Ask the Gynecologist. It's the first of its kind, and we are grateful to God that we've been able to make change, and we are still making changes in lives of people all over Nigeria, all over West Africa, and even as far as the Southern African countries, Mozambique, Zimbabwe, Kenya, Botswana, South Africa, and all the countries, including Tanzania. We have gotten reach there, Sierra Leone, Ghana. I was in Ghana 2 years ago with my wife, and as far as Cameroon, Togo, Benin Republic, and it's been a wonderful time, and we are still making an impact all over Nigeria. You're well aware that we are almost ready with our IVF center, state of the art, and one of the first IVF centers in Nigeria, especially Lagos, that caters for IVF for the low income families, to ensure that people that want to get pregnant, okay, are able to afford it at the cheapest cost available. See, IVF has been out of the reach of the common man, and therefore we've decided and we've committed to this journey in ATG to ensure that we are able to bring this new IVF center to people around Lagos. And we've chosen Alimosho local government area because it's the biggest local government area in Lagos, and therefore most people that live there might need access to IVF, and other people in other surrounding local governments as well, they will need IVF, and this center will cater for people, and you can come there and get IVF at its cheapest affordable price to ensure that getting pregnant whenever you want, if you wish, and whenever you want to as a lady is within your capacity, is within your capability, and nothing will stop you except you yourself. So nothing is going to stand in your way of getting that IVF treatment if you wish, if you want. And this is our desire at Ask the Gynecologist, and we will not shy from this opportunity that we want to give people like you watching me. So tonight I'll be talking about pap smear. Pap smear, cervical smear is the same thing. We are broadcasting tonight simultaneously on Instagram and on Facebook, and we're going to put this post as well on YouTube without delay, if possible tonight or very early tomorrow. Today is Tuesday, and it's a wonderful time. Tuesdays are always the best time, and I give glory to God for being here, and I'm sure definitely you too are happy to be here. Before we start taking questions, let us quickly dissect this topic, okay? And as I'm talking about this topic tonight, I'll be taking questions simultaneously together to ensure that people are carried along and people understand the things we're talking about here regarding cervical smear and pap smear. First of all, there's a question on the screen, and Gloria is here. She's one of our moderators, and She's here and she'll be moderating behind the scene. There's a question from Susie Oluchi. A question from Susie Oluchi. Please, Gloria, help me capture that question from Susie DK Oluchi. And once we're taking question, I will capture that question again. And tonight, I have a lot of people watching us tonight. Gloria Konji, she's a moderator. She'll be moderating here, and other our team members will be here shortly as well. I can see Oshide Kojade Sola, Juliet Amaka Charles, Susie Oluchi, Olajumoke Adeyemi Williams, Onyia God's Gold, Nkiru, Valiant Simon, Odiaku Okoro, Jessica, Ammonia Green, Adeyinka, Oluwaseun Ogunlaja, Ayuwu Patience, Adedokun Adepeju, wonderful name. Ayuwu Patience, a wonderful lady. Christina Oladumoye Nwosu, she's one of our ambassadors for the IVF Center, and you'll be seeing her face shortly and more prominently soon as possible without delay. For Lashade Emmanuel Esikamen, Daniela Fabian, Ola Yinka Anibi, wonderful lady. I thank you so much, my sister, for being here. My sister Ola Yinka Anibi, you're so welcome here. Funi Edo, Bosse Deola Jumoke, Jameson, Uche, Ezekaka, Udeaku, Okoro, Olori, Abisoye Ige, Olori Squared, you're welcome here. Omeza Taye, Ngozi Osamo, Arobodo Chioma, Ofoegbu Okolisa, Amas, Becky, Ebi Kate Bernard, Susie Dike Olochi, Olusoya, Elizabeth Olariwaju, Giselle Enji, Caro Kings, wonderful guy. Gracie Shadia Bagre, Chidima Ebubechukwu, Olubumi Alao Oluwashino, Clarice Mama, Ngozi Anthony, Juliet Amaka Charles, Nwobu Ogochukwu Charity, Mary Sapong, Chidima Gloria Udeogu, Yetunde Adams Tubogbo, Chinwe Ibekwe, Perpetua Chukwu. I'm sorry if I've pronounced your name wrongly. Please apologize. I'm apologizing for that. If I've missed your name, please sorry about that. Ngozi, Gracious, Kingsley, Emmy, Jenny, you're all welcome there. Puish, Goldie, Antonia Chinyere, Mona Samuel, all of you, welcome, beautiful people, beautiful ladies, handsome young men. Thank you so much for being here. Damlola Kinwale, Jane Dera, Augustine, Vicky, Oluwakorede Ogundele, Vivian Ada Abegongwe, Akinsomi, Laura Joseph. And on Instagram here, I cannot mention the names because they are all like coded, passworded names. Dewumi, Cynthia Siwi, Roya Infinity Palmer, Cynthia Siwi, Sweet Meg, Inkeda, you're all welcome here. Debbie Rice, Samantha, and everybody watching from Instagram here, you're all wonderful people, beautiful people. You're welcome here, and I'm so happy to be your host tonight, and it's going to be a wonderful time. So if I've missed your name, please apologies, and if I've mispronounce your name, please apologize. I'm apologizing as well. So first of all, what is Pap smear? Pap smear is the same thing as cervical smear. What we do by doing Pap smear is it's not your routine cervical smear. Pap smear is not your routine vaginal swabs to check for infection. No. Pap smear does that and more than that. Okay. First of all, you must know this. Pap smear is not painful. Most people, when they hear cervical smear or Pap smear, they want to run away. It's not painful. It's like basically like a simple vaginal examination. It's like basically you having sex, okay? But you're not having sex. What I'm saying is we're putting swabs into you like the way we put tampon, okay? So I'm so sorry for using that example. Pap smear is not like having sex, okay? But Pap smear is basically an examination. Right, like we're examining you to take swabs from you. I'm so sorry to use that example that like you're having sex. Sorry about that. So I take that back. So Pap smear, okay, is like an examination. It is an examination. So we put a speculum. Speculum is that thing that opens like a V when we put in your vagina to see inside. Without the speculum, we can't see anything in your vagina because the vagina is a dark place. Okay, normally. So we put the speculum in. It can come as a plastic speculum or as a metal speculum. The metal one is a bit cold, so it could be slightly uncomfortable, but the plastic one is comfortable, is probably, and is disposable, so probably it's a bit expensive, but it's available in most places anyway. So we put that speculum into your vagina, open it up. That is the least, that will be the maximum discomfort you have during that examination. So we open that speculum up, what we see by doing that is your cervix, and that's exactly what we see. So we open the speculum. It helps us to see into your vagina. So that is the vagina. That's what we see, and we see the top of the vagina. Okay, that top of the vagina is what you feel when you put your finger into your vagina as far as it can go. You feel that soft substance at the top of the vagina that feels like a soft nose, feels like a soft rubber. That is your cervix. Okay, that is your cervix. That is cervix that opens up to allow baby to come down when you're in labor. So we examine you, and what we're looking for is to take swab there, to take a smear there. Okay, so we take that smear, we put it on a slide, or it goes into a water-based solution. It goes to the laboratory. It is smeared on a slide, and then it's looked at. In those days, we used to use a spatula to collect this the sample from your cervix, and we put it on a slide. But that cannot be, that is not very accurate. Nowadays, we have what we call the LBC, the liquid-based cytology. LBC, liquid-based cytology. So basically, that swab goes in your vagina, takes the swab like 360 degrees 3 or 4 times around the cervix, and we come out, we plate it on, and we put it in that water solution. It goes to lab, so that in the laboratory they can spin the solution and decant and use the cell that is settled over and over to get the best result from you. Now, it is not painful. Okay, it is not painful. Sometimes whenever we want to do the cervical smear or pap smear, it's the same thing. It's just different name, British name, American name, same thing. Pap smear, cervical smear is the same thing. It involves getting you examined in the vagina, and they will take swabs. Sometimes some people might have offensive discharge or lots of discharge in the vagina. Before we take that smear, we have to clean that discharge away so that it does not affect the result of the smear. Or sometimes if we think that that person's discharge is possibly an infection, we take swabs to check for infection. We send that off to the laboratory. Okay, so we do that. So once we've cleaned the vagina, we've taken the smear sample, it goes to laboratory. Within a week or two, you get your result. And then we then say, okay, after the result, if we think you need any further treatment on your cervix, then we go ahead. What is the purpose of pap smear? Purpose of pap smear is to examine your cervix, okay, and to catch any cells on the cervix that is trying to become nasty, trying to become precancerous, trying to form the early stages of becoming cancer of the cervix. So taking pap smear helps us to identify such part of your cervix or part of the cells on the cervix that may become cancerous if in future they are left alone. So those cells, okay, that we see, that we are trying to sample, they might be an indication of a possible change down the line to become cancer. Sometimes those cells will revert back to normal and they're not cancer again, but sometimes too they might progress and become cancerous. That will take 3 to 5 years down the line. Nobody knows, but on average, if we see precancerous cells in your cervix, they could become cancer 3 to 5 years down the line. So the purpose of you doing this cervical smear, this pap smear, the purpose of you going through this stress, as you put it, of this cervical smear, pap smear, is to identify cells on your cervix that could be sign, that could be indication, that could be warning sign, that could be a precaution, okay, a precursor, to cells that could become nasty, cells that could become cancer. So this form of smear test is one of the best ways to diagnose, catch any cells on the cervix that could be injurious and dangerous. It's safe. The test is safe. We do it, and it's very, very reliable. And what you should do is that once you are above 25 years old, before you are 64, you should be having these cells, this smear test, within 3 to 5 years. In some cases, we do it for you and the result comes back. It's normal. Case closed. We bring you back again 3 years down the line to check it again. Okay? 3 years down the line, check it again. And if it's okay, we'll bring you again 3 years. So it's 3 years. It doesn't take more than 5 minutes. Any doctor can do it. Any nurse that is trained can do it. In fact, even midwives can do it too. You don't have to get a doctor to do it, okay? In some clinics, doctors do it. In some clinics too, nurses can do it. It's just a simple examination. And in fact, in some laboratories too, some lab assistants can do it for you and get it onto the lab. If you want to do your pap smear in Lagos and you don't know where to go, just go to the ATG laboratories. We'll do it for you there, okay? It's affordable, doable, you get a result quickly within a week to 2. Less than a week, you get a result anyway, and it's sent to you by email, sent to you by your WhatsApp number. And if you need any treatment as well, we'll arrange that for you. Now, if your cervical smear test comes back and that you need a treatment, what we usually do is to go in, and sometimes we could take a piece of cervix away that is that particular area that is dangerous. We cut it away and it heals on its own and it doesn't disturb you at all. In some cases, we might even take much more chunk away from your cervix if we see that we have to treat you more. In such a case, that could lead to shortening of your cervix, and it does not affect your labor. But in some instances, very, very rarely, if we have to take a big chunk of your cervix away because of bad cells on your cervix, which is very, very rare, it could make you go into preterm labor. But I tell you something, it's very, very rare. Very, very rare. In most cases, we take only a small, if we have to treat you, we take only a small chunk away of your cervix. Very rarely do we have to take a big loop away. We call it large loop excision of transformation zone. So in very, very rare situation, we need to take a big chunk of the cervix away. But that is, I said it again, is very, very rare. In some cases, we bring you back again 3 years down the line, and then your cervix is clear and you go. If we need to treat your cervix following any sample that is bad that we see from you, we treat you, we see you back a year, and if you're all clear, we see you back in 6 months. If you're all clear, bring you back again in 2 or 3 years time to follow up back to your normal routine. But in most cases, even if your test is normal, we see you every 3 years. If we have to treat your cervix for any bad cells that we catch, we see you first time 6 months after treatment, and then depending on the result we get, we might see you a year or 3 years back again as usual. But the test is very, very safe. It's easily done. It doesn't disturb you from getting into labor. It doesn't cause infertility. It doesn't cause any damage to your cervix. Just a test. Even in countries now in the UK, before we even do the this test, what we do is we even take a swab from your cervix and we check for a particular virus called HPV. HPV virus is called human papilloma virus. Human what? Papilloma virus, HPV for short. This particular virus is what we look for. So if we swab you, okay, and we get that, oh, this lady has HPV cells on the cervix, then we now go further to do cervical smear. If we do use test and we see this smear test, a swab test, and we see that you don't have HPV, okay, we don't bother doing cervical smear on you. The reason is that we've noticed that from research that this particular virus called HPV, if it's found on your cervix, it's very, very possible that it causes these changes on your cervix that we are looking for. So in some cases now, in good countries now like UK, America, we test for the HPV first on your cervix, okay? And if it's not there, we don't bother with cervical smear. But if it's there, we now go further down the line to do cervical smear to look for these bad cells on your cervix. Now, doing this cervical smear test, if you're pregnant, you don't need to do it. But if you've had bad cells on your cervix before you got pregnant and you are due for a recall test again, and that recall test date falls into your pregnancy period, we need to see you. However, if your test has always been normal before you got pregnant, you don't need to have your smear taken during pregnancy if your 3 years appointment falls into your pregnancy period. So for example, now, if you've done a smear test, okay, and you're due and it was normal 3 years ago, and you're due to come back for another smear test now, but now you're already pregnant, we can postpone it until after delivery. The reason is that during pregnancy, the cells on the cervix change their behavior, and it's very difficult to interpret the smear test during pregnancy. So what we do is that as far as your smear test was normal before you got pregnant, we can shift your routine recall till after pregnancy. However, if your test was abnormal before you got pregnant and your retest date falls into around your pregnancy, we need to do it, because we don't want. I've seen people that had and developed cancer of cervix during pregnancy. It's very, very rare for a woman to form and have cancer of cervix during pregnancy, but it's possible, but it's very, very rare. So if your smear came back okay and your 3 year recall falls into your pregnancy, we can postpone it after you had your baby. But if your test before pregnancy came back bad and you're in a follow-up maybe 6 months afterwards, and you fall pregnant accidentally while your 6 months is up you're about to reach, definitely we have to sample you and examine you during your pregnancy. It does not cause labor, it does not cause preterm labor, it does not cause prematurity of your baby. So if you need to have your smear test done during pregnancy, which is very, very rare, then you have to do it. Okay? Are you following me? Now, your cervical smear, like I said again, the purpose is to catch cells on your cervix that could be dangerous. And let me tell you something, cervical cancer is what we're looking for. If we see cells that are changing and they look as if they're going to become cancer soon, then we have to treat you and take a big chunk of cervix away. Even if we have to do that, okay, we give you injections to what we call local anesthesia to numb your cervix so you don't even feel pain while we are treating you, to take any cells or part of the cervix that's abnormal. So cervical smear test is safe, and in fact, in the last 30 years, it's one of the novel, innovative treatments in gynecology that helps and is works to prevent cancer of the cervix. Cancer of the cervix now is becoming very, very prominent in Africa, becoming very, very prominent in Nigeria. And the bad thing is that it can be treated, it can be prevented, but if it's gone advanced, it can kill and it can knock out the kidneys, because the cervix is very, very close blood supply to the kidney. Cancer of the cervix can spread to the kidney, and once the kidney is knocked out, that person will have problem, that person will need dialysis, and that person is next to God. Okay? I don't pray it happens to my enemy. I don't pray it happens to my enemy. I don't pray it happens to my friend either. So to prevent cervical cancer, you should be having cervical smear regularly every 3 years. Now, if someone will say, but doctor, how do we get HPV? As far as you're of a sex age, you are in that age where you're already sexually active, you are exposed to HPV. Okay, once you're sexually active, you're exposed to and you're prone to catch HPV. As far as you're an adult, HPV is already in your system, and there's no way we can clear HPV out of anybody's system. Let me say something. Once you are old, you've kissed before, you've had sex before, you are exposed to HPV. So the best you can do for yourself is to have your regular cervical smear every 3 years. Every 3 years. If you miss any appointment, as soon as you remember, go and get it done. Okay? If you want to get your cervical smear done in Lagos, you're close to Lagos mainland or even on your island, and you don't know where to go, or you need somewhere reliable to get a test done, you can walk into ATG Laboratories and we'll welcome you and we'll do it for you there without delay. Okay? Thank you. So let us continue. Like I said again, after I finish my talk, I'll take questions, okay? So hold on. Now, cervical smear test does not cause infection. Cervical smear test does not make you prone to PID. Cervical smear test does not give you PID. It does not cause damage to your womb or your ovaries. It's a simple test. In fact, if you've done it before, you know it's not painful. It's not painful at all. It's simply you put your legs on the couch, open your legs, we put in a speculum, and we take a swab test, and we go to a laboratory. And within a week, you get a result. Case closed. Now, let's take questions now, because people are already asking questions and they want their questions answered. And that's why we are here. Now, as I'm answering the questions too, other things I've overlooked while I was talking, I'll cover it while I'm answering questions. Okay, so please pay attention to the answers I give to the questions. Okay. Thank you, Gloria. Thank you, Elizabeth, for putting the address. If you want to do your fertility test, your hormonal profile test, and you need somewhere to go with reliable results, to get your reliable results, you can always walk into ATG Laboratories. And if you want to get the address of ATG Laboratories, it's already on your screen from Elizabeth and from Gloria. And if you've not already registered to attend this seminar this month, the Ovulation Masterclass for March 27th this month, just go and get registered now for that seminar. We're going to start it soon, and you don't want to miss anything of it. If you've attended my seminar last year, September, where we talked about ovulation, my God, you will know it was wonderful. And this year, I've done more research, and I'm going to put things to you clearly to make it easier. Somebody's asking a question, what causes ovarian cysts? We don't know. Honestly speaking, we don't know what causes endometriosis. We don't know what causes fibroid. We don't know what causes ovarian cysts. However, if we see them, we know what to do with them. Okay? Now, if you've not yet subscribed to follow us on YouTube, go and click and follow our link, and to ensure that you watch us on YouTube. The reason is that the way Facebook algorithm does videos, some videos that are done today, you will not see it again. You see it next week. Some we did today, you just go up. And you see, the way Facebook is, the timelines I see on my own app, Facebook, is not what you see on your own timeline on your own Facebook. But when you go to YouTube, all our videos are archived sequentially, and you will not miss anything. If you've gone off ATG for a week or two, or a day or two, and you want to catch up to know what we've done recently, just go to our YouTube page and you see all our videos. They're sequential there. You can watch them. Okay, and more videos are coming up. We're getting to edit our videos and we're putting it up there. Someone is asking a question: what is cervical erosion? Cervical erosion is just basically changes on the cervix, okay, which are usually hormonal, not infection. Hormonal, because every month your hormones level changes, especially your progesterone and estrogen. And in fact, even during pregnancy too, your hormone levels will change, they'll fluctuate. That will make your cervix very, very raw. And sometimes during sex, it will spot, it will bleed a bit. And that's what we call cervical erosion. It's common in pregnancy, okay? And sometimes it's very common too if you have yeast infection as well. And if you're on contraceptive pill as well, that could happen too. But it's not a disease, it's not infertility, it's just due to hormonal cyclical changes, this cervical erosion. Okay, thank you Yetunde Adams Tubobu for asking that question. God bless you. Now let's move on to another question on the screen here. Somebody saying, what is the name of our YouTube page? There's a link that Elizabeth just put it on now. Just go to that link and type it in. Just put Ask the Gynaecologist on YouTube and you see our page pop up. You can click subscribe, you can follow us. Someone is asking, doctor, you did doctor, can chlamydia test be done through pap smear? No, chlamydia test is different from pap smear. Chlamydia test is a swab for infection, but no. Now listen, if we are doing a pap smear and we see, and you want to do a chlamydia test, we can take chlamydia test swab before we do the pap smear, or we can take it after. Okay, so we can do all these swabs, eye vaginal swab, cervical swab, chlamydia test swab. We can do it while taking swabs for pap smear, but they are all separate things. Okay, so the swab what we use for the cervical smear is different from the chlamydia and the eye vagina, but we can do everything at the same go with different swabs. Okay, so we examine you now. We have this swab, take it for eye vaginal swab, goes away. Chlamydia swab goes away. Cervical smear goes away. So we can do everything at one go, but they are different tests too. They're not the same thing. What is the best way to deal with ovarian cyst? If you have ovarian cyst, if it's a simple cyst, you leave it alone. If it's a simple cyst, it's less than 4 centimeters, leave it alone. Simple cyst is called simple because it contains only fluid within them. In most cases, we'll bring you back again for a scan 3-4 months down the line, and those simple cysts, they will disappear on their own. Now, if you have a cyst, whether simple, whether 4 centimeters, that is causing you pain because it's twisting, cysts can twist on their own. And if the cyst is twisting, it can cause pain, especially if they have more than 5 centimeters. Any cyst causing pain or cyst above 5 centimeters must be looked critically into and decided whether we need to remove it at that point in time. Okay, that's the best way to manage cyst surgically, and there's no medication that is designed to smelt or to shrink a cyst. Okay, most cysts that are less than 4 centimeters will disappear on their own within 3 to 4 months down the line. So we scan you 3 months time. So Adebola Lijadu Adeboye just asking, how soon should one go for another test after 2 lip procedures? So 2 procedures was done within 6 months. So if you've done lip procedure, is basically we taking a chunk of cervix away because we found some cells that are a bit nasty or suspected previously. So when you've done a lip procedure, you must go back 6 months again to get your smear test done to ensure that there's no bad cells on your cervix. Okay, and if we find any bad cells there, then at that point again we need to treat it again. Okay, we can't leave it alone. But if after 6 months you've gone for that follow-up swab test and it's normal, we leave you alone. That's it. Can one get pregnant with 6.5 lining? Unlikely. To get pregnant, usually we aim for endometrial lining about 12 millimeters. Okay, thank you, Alalade Mayowa. Endometriosis is not cancer. Endometriosis is not cancer. Adenomyoma is not cancer. Myoma, fibroid is not cancer. Okay? Endometriosis is not cancer, okay? Endometriosis is not cancer, okay? Now, we have on Instagram, and somebody, Cynthia, is asking, doctor, please, is it normal to have sharp pain in early pregnancy lasting for 3 to 5 minutes? It can happen. But if there's pain in early pregnancy, get a scan. Because a pain in early pregnancy could be just normal. But it can also be a sign of miscarriage. It can also be a sign of ectopic pregnancy. So if you have such pain in early pregnancy, get a scan done to check that the pregnancy is in the womb and that the pregnancy is okay. Thank you for that question, Cynthia Sewi. If you're watching us from Instagram, welcome once again. Mom C. Imran is saying, doctor, I'm having sharp pain. What could be the cause? Sharp pain could be from appendicitis. It could be from ovarian cyst. It could be from fibroid. If you're pregnant, it could be from ectopic pregnancy. Thank you so much, Lady Wooks Mickey. Lady Wooks Mickey is here. She's a wonderful lady. She's one of our wonderful members here. Adebola is asking, can pap smear be done after delivery? After delivery, pap smear should be delayed for at least 2 months before it is done. Pap smear should not be done immediately after delivery. We don't do pap smear immediately after delivery. We need to allow the pregnancy changes on the womb to resolve before you do a pap smear, okay? Thank you. Adebola Lejadu Adeboyejo, pap smear is not done immediately after delivery. We need to allow the womb to revert back to normal. That will take about 6 weeks to 2 months, okay? So there's no rush, okay? Thank you, Mom Simran. Thank you, Adebola Lejadu Adeboyejo. Let's take other people's question, please. We have other people waiting here. Clara Omosefe Eboe, she's saying, what causes one to be spitting blood? Sometimes at night, I give up-seeing dentist. If you're spitting at night, it could be that you got a chest infection. It could be that you have pneumonia. It could be that you are allergic to something around you at night that you're reacting to. Yes, that could make you to spit blood too. Okay, so we need to check you. Do a sputum test, do chest x-ray, and also you need to review in terms of allergy. Probably you're reacting to something around you at night when you're in bed. That makes you to cough or spit something bloody at night. Okay? Victoria Baby say, what is pap smear? Okay, we've talked about it at the beginning. So Victoria Baby, it seems you're a bit late to this show. So go back and watch this video over again on Instagram or on our YouTube page or in this Facebook page, and you catch up quickly what pap smear is. Pap smear is the same thing as cervical smear, and what we do is we are trying to take swabs from your cervix. It's not painful, and we are looking for cells that could be suspicious of being able to become cancer if left alone 3 to 5 years down the line. They're not cancer, okay, but if left alone, they could become cancerous 3 to 5 years down the line. So don't wait until they become cancer. So you should be doing your cervical smear every 3 years so that we don't miss anything. Lives have been saved because we've done cervical smear. And if, God forbid, you're HIV positive, you should be having cervical smear tests done every year. HIV positivity increases the risk of such changes on the cervix becoming cancerous much quicker. So if you have diagnosis of HIV, God forbid, you should be having a cervical smear test every year. Every year. If you got issues with kidney problems, you're on kidney, renal dialysis, you should be doing your cervical smear every year. All right, because such chronic debilitating diseases, they make people immunocompromised, and HPV can become quicker, nastier, and can cause diseases quickly, much faster on the cervix. Somebody is saying, can one get pregnant after 3 surgery? Why not? You can get pregnant. Can HSV, some Damila is saying, can we do HSG at Lagos lab, at our ATG Lagos lab? Not yet. The only thing we can do at ATG lab is HSG because we're still trying to get a space to put our X-ray machine. We don't have that space yet at the ATG laboratories, but definitely in the next few months, space will come up at our location and we're able to do HSG test at the ATG laboratories without delay by the grace of God. Somebody is saying they're having sharp pain in the right lower abdomen. Please get a scan quickly to check your ovaries, a scan to check your appendix, and to check your womb, and get all results to me as soon as possible. Thank you, Adebayo Yetunde, for that your question. So I hope I've made some sense out of cervical smear today. I need to get off the line, and I'll see you shortly as well Thank you once again for listening to me tonight. Thank you for spending part of your data to listen to me. I really appreciate it. And once more I say, have a wonderful day and have a wonderful rest of the week. I love you so much. And I love myself too. Have a wonderful time. Bye-bye.